The next disease is Lyme disease. This is a bacterial disease caused by a bacterium known as Borrelia burgdorferi. And this particular disease is transmitted through the bite of an infected tick. So the tick essentially serves as a vector that can transmit the disease to a human host. This disease is more common in the north. So, for example, New York, Connecticut, Ohio, those are areas where you will find high incidence rates of Lyme disease. So when you get bit by a tick that was infected with Borrelia burgdorferi, the first sign that you will experience relatively quick is a bullseye rash, such as the one we see pictured here. And that should be the first indication that you may have Lyme disease. About 70% of people that get bit by an infected tick will get a bullseye rash. Obviously, the other 30% would not have the rash, but ideally, as soon as you would see the rash, you would want to seek medical treatment to stop the disease from progressing. If you do not, then ultimately it will progress to more serious signs and symptoms. So let's assume in this case an individual was bit, they saw the bullseye rash at the bite site, but then didn't think anything of it, and that did not seek treatment. So ultimately the infection gets worse, and patients will start to experience some non-specific kind of signs and symptoms, fever, headache, stiff neck, dizziness. You may not be thinking Lyme's entirely at this point, because those signs and symptoms are often seen with something like meningitis too. So what would likely be a really strong indicator of Lyme's disease is crippling arthritis. So crippling arthritis is the primary symptom outside of the bullseye rash, but it is the primary symptom associated with someone that has a Borrelia burgdorferi infection. The way this bacteria works is when it gets into your body initiates an immune response against it. So your body produces antibodies that can target the pathogen for destruction. But unfortunately, those antibodies can also cause inflammation at the joints, which ultimately leads to very severe arthritic symptoms. Another thing that can also happen as the disease progresses is facial palsy, which is partial facial paralysis. So it is a progression. I mean, you would first see the bullseye rash, and then if you don't seek treatment, then it progresses to severe arthritis, and then if you continue to not seek treatment, then it progresses to facial palsy. So as far as prevention and treatment, there's not an official vaccine for humans. There is a vaccine that's offered in endemic areas that can be given to animals such as dogs, but there's not a human vaccine. So to avoid Lyme's, it's really avoiding exposure. So if you're going to be in areas where there's a high amount of ticks, you would want to utilize insecticide and wear protective clothing, pants, long sleeve shirts, hats, protective shoes, those sorts of things. If you do get exposed to Borrelia burgdorferi, you can prevent the progression. So as soon as you see the bullseye rash, you go to the doctor, you get tested for Lyme's. If you test positive, they're going to put you on antibiotics. Most of the time you'll be prescribed doxy, and it's typically a long course of antibiotics, on average about 28 days that you'll be on them. But if you get on them before the main signs and symptoms begin, so before the arthritis, it'll never progress to being the painful disease that we know it as. But if you wait until the arthritic symptoms start, then obviously it can be a bit more extensive to treat. Usually it's still treatable, so again, it would be the same thing. Patients would be put on doxy, and most individuals are going to make a full recovery, even if they wait to seek treatment until they start to experience the crippling arthritis. But in some individuals who seek treatment later on, because those antibodies have already been produced, in some individuals it can lead to chronic Lyme's disease, which chronic Lyme's disease essentially can lead to debilitating arthritis for the remainder of someone's life. So it's so important to get it treated early on so that, one, you don't develop the severe arthritis, but two, so you lessen the chance of it becoming chronic Lyme's. But even in individuals who wait to seek treatment, chronic Lyme only happens in about 10% of individuals. So again, most of the time, even if you wait to the point where you are symptomatic with arthritic symptoms, the doxycycline will alleviate the bacteria and stop the infection, and most patients will make a full recovery. This bacteria is it's pretty tricky on your immune system. So when you get infected with this bacteria, your bacteria again responds by producing antibodies, and those antibodies would normally bind to the bacteria, mark it for destruction, and that would be the end of it. But this bacteria is unique in the sense that it can change its outer antigens. So when it gets into your body and your body produces the antibodies to fight it, the antibodies don't recognize the bacteria anymore because the bacteria has already changed its antigens, so the antibodies are essentially useless. All they do really is cause inflammation around the joints and lead to the arthritic symptoms. So with Lyme's disease, it is a disease that needs to be treated with antibiotic medication. Those antibodies are not going to be effective because of the bacterium's ability to switch its antigens. So need to be put on a longer course of antibiotics like doxy to get rid of the bacteria. The next disease is infectious mononucleosis, or mono is what we often call it. This is a viral infection caused by the Epstein-Barr virus. This virus is a herpes virus, so once you become infected with the Epstein-Barr virus, it does establish dormancy, and it will stay in the body forever. As far as transmission, it is fairly contagious. It is spread through direct and indirect contact with saliva. So if someone that has mono would kiss another individual, it could be spread that way. But also if someone was using eating utensils that had the virus and shared those eating utensils with another individual, it could be spread that way. So it is spread through exposure to saliva, which is why sometimes you'll hear mono referred to as the kissing disease. Interestingly enough, the Epstein-Barr virus, about 90% of the world's population is currently infected with the Epstein-Barr virus. So most individuals that you know have likely been exposed and infected with Epstein-Barr, but only a small percentage of people actually get mono. So with mono, typically people in their adolescence or teenage years are going to be the most susceptible. So they define adolescence as being anywhere from the age of 10 to 18. So this would be the group of individuals that, if exposed to the Epstein-Barr virus, would be most likely to get mono. So if you are a young child and you get infected with Epstein-Barr, nothing happens to you. The virus goes dormant. There's no illness. If you are an adult and you get infected with Epstein-Barr, nothing happens to you. The virus goes dormant. That's the end of it. But if you're in your adolescent years, 10 to 18, when you first become infected with Epstein-Barr, then you can get the disease that we know as mono. So adolescents or teenagers are most susceptible to getting this disease. So what happens when you get mono? If you know anyone that has had mono, you know that they feel awful when you get this infection. So one of the primary symptoms that patients experience is fatigue. And this is extreme fatigue to the point where they can't get up and get dressed. They can't go to the bathroom. They can't shower themselves. So it is extreme fatigue. Another thing that some individuals experience, this is more of a complication, is an enlarged spleen. Most of the time when individuals get mono, they can just bed rest at home. There's no need for hospitalization. However, when patients do experience a large spleen, enlarged spleen, they would need to be hospitalized to kind of monitor that. Sore throat is quite common as well, high fever, and then cervical lymphadenopathy, which is a mouthful. This basically just means a swollen lymph node in the neck. Because the body is activating immune cells to fight the infection, those lymph nodes would get swollen. So we would expect a swollen lymph node there in the neck. As far as treatment, there isn't any. This is typically a self-limiting disease, so most individuals are going to make a full recovery just with bed rest at home. You may want to watch the fever to make sure that it doesn't get too high, provide relief for the sore throat, but really there's nothing that needs to be done. There's no antiviral medications that need to be given. The only time hospitalization is required, again, is in cases where that spleen needs to be monitored. So no treatment, really no prevention either. There's no vaccine. So it's just during that adolescent years, I suppose, avoiding contact with other saliva. But no treatment, really no prevention. The next disease is anthrax. Anthrax is a bacterial disease, so the causative agent of anthrax is a bacterium known as Bacillus anthracis. This bacteria is gram-positive. It obviously has a rod-shaped appearance, as we can see in the picture, but what we can also see in the center of these cells in the image is the presence of an endospore. Bacillus anthracis is able to form endospores, which means it can survive in harsh conditions for extended periods of time. So typically, Bacillus anthracis will be able to maintain dormancy in the soil for long periods of time, and then that can allow it to be transmitted through a variety of different ways, but it is able to survive in harsh conditions. It is primarily found in the soil. So within the soil, these endospores could get dispersed into the air where someone could potentially breathe it in and get the infection that way. If someone had an open wound and they were in the soil, that the endospores could get into the wound through that route. If these endospores would make it into the gastrointestinal tract of an animal, the animal could become infected, and then if you eat from an infected animal, you could get it that way. Or if they would get into water that you ingest, you could get it that way. I mean, there's a lot of different ways that you can get a Bacillus anthracis infection, but these bacteria are found in the soil, so various different contacts with the soil or things that are exposed to the soil, like animal hides, vegetables, could potentially lead to transmission. So there are different forms of anthrax. There's three: cutaneous, which is a skin infection, gastrointestinal, which is obviously a GI infection, and then pulmonary, which is a lung infection.